New concerns are being raised about the security of Canadians' health information. Experts say our data is at risk of being accessed and used by foreign entities for surveillance purposes without consent. That's because much of our health information is entered into electronic medical record systems that are controlled by a handful of providers outside of Canada. Experts say that Canada's privacy laws are failing to keep up with changing technology, and this is putting our data sovereignty at risk. So, how concerned should Canadians be? For more on that, we want to bring in Dr. Kumanan Wilson. Dr. Wilson is the Chief Scientific Officer of the Bruyère Health Research Institute, and he joins us today from Ottawa. So welcome, and thank you for joining us here, Dr. Wilson.
And thanks for having me on.
So you did recently co-author an article for the Canadian Medical Association Journal about the importance of ensuring the sovereignty and security of Canadian health data. So I'm hoping that you can help us understand here what the danger is, as you see it, with how our health data is currently being stored.
Sure. This problem really emerged after September 11th and the introduction of the USA Patriot Act. At that time, the act permitted the U.S. government to access data held by U.S. companies for national security purposes. And this applied to any U.S. company, including healthcare companies or data storage companies, even if they were operating in other countries. At this time, it was felt that the best mechanism to protect Canadian data was to ensure that the data was stored on cloud servers that were located on Canadian territory. At the time, there was uncertainty whether that really did provide the protection we needed, but it remained primarily a theoretical argument. The concerns of terrorism subsided, but with the introduction of the new government and a much more aggressive approach towards Canada, these concerns have reemerged.
So all of this, in some ways, in hindsight, seems like it is a massive vulnerability. How did Canadian medical data, how did it get to this point where it could potentially quite easily fall into the hands of these U.S. companies?
Yeah, so most, for hospitals, for example, most of the EMRs are run by American companies, Epic, Cerner, and Meditech. But the real concern are the cloud servers that host data, and so the three American giants, Google, Microsoft, Azure, and AWS, and they host not only healthcare data, but a lot of data for many Canadian companies and Canadian individuals. They do not, our assumption, they don't want to transfer data, but they are subject to U.S. laws. And we also know that this current U.S. administration likes to put pressure on U.S. companies to help achieve its goals, i.e., idea of contracts and such. And so there would be substantial pressure for them to hand over data if the U.S. government wished them to do so. Now, there'd be two reasons why the U.S. government may want this data. The first is for security and surveillance purposes. And we know that's a priority there. They've hired Palantir to potentially do this in the U.S. But there's also the value of this data. Because of Canada's public health system, we have a true population-based data set that's invaluable as we enter into a health AI era. And I think Donald Trump just announced today a collaboration of major U.S. companies that's going to focus on digital health and AI, and having access to any data will put the U.S. in a stronger position.
It might be helpful here to understand what type of health data we're talking about. Could it be someone's health history, their blood type, their family history? Like, what sort of information are we talking about here?
I mean, it's virtually all of that data. So anything that is inputted into an EMR system would be potentially accessible, because that would be stored on the cloud, and that would include clinic notes. And now with natural language processing, that's easier to pull out information from that, as well as lab results, medications, family history. So there's an enormous amount of data there that exists for us, and that's really good for us. These EMR systems are great for medical care. We can have better access to information, but this data does have to be stored, and it needs to be stored securely. So it's on these cloud servers. And that's the vulnerability presents itself.
So how do other countries try to protect this medical data? What could we potentially learn from some of those other countries?
So our thoughts are there's some things we can do quickly and something that will take longer. So, we think data encryption is very important, data encryption by design. That provides a large portion of protection, but it's not 100%. Making sure the data is stored on Canadian territory will help. It could give the company an argument that they are subject to Canadian laws and they can't transfer the data. But what my co-author, Michael Geist, suggested is to introduce a blocking statute in PIPEDA. That's the privacy legislation that governs companies. And this would be analogous to what they do in Switzerland when other jurisdictions want their banking data. They create a competing law so that the companies have an excuse, or the banks in the case of Switzerland have an excuse saying, well, I appreciate your law says I have to transfer the data, but the law of that country says I should not transfer the data. So at least that can slow down the process, take it to court, result in some negotiations. Ultimately, though, I think we are, sovereignty is a major concern in Canada right now. Do we want our health system controlled by another country that's acting in a somewhat hostile manner towards us? And standing up sovereign Canadian data servers should be a priority. It's easier said than done. Those American companies are dominant in the market because of the type of service they do provide. So we would need to determine our capacity and then support the development of Canadian sovereign data servers.
Dr. Wilson, thank you for joining us on this today. I suspect that a lot of people, this was not necessarily on their radar or something to be thinking about. So thank you for bringing all of that to us. We do appreciate your time.
Thank you for having me on.
Dr. Kumanan Wilson there for us in Ottawa.